Hi, so this is our first lecture on development, and in this lecture, we'll talk about infant development from birth to 1 year. So let's start with the learning objectives. In this lecture, we want to become familiar with the major physical, cognitive, and social landmarks of infancy, and learn the definition and normal development of the following processes: object permanence, joint attention, social referencing, deferred imitation, emotional refueling, stranger anxiety, and separation anxiety. So let's start with some of the physical changes infants experience. Newborns sleep much of the day and night and wake only for feedings every few hours. By 1 to 2 months, they achieve greater modulation of their sleep-wake and feeding cycles, and by 6 months they achieve control of their head and neck, hand-eye coordination, reaching and grasping for objects, bringing their hands together, and eating solid foods. So let's watch a short clip of a 6-month-old baby, Majestic, to notice some of these abilities.
Majestic's back, neck, and leg muscles are strong enough at 6 months to do something new: sit up with support. Sitting up allows Majestic to see more of the exciting world around her. Plus, the sitting position frees up her hands to explore things.
Alrighty.
Majestic's dad props her against a pillow while she keeps herself busy. For safety, Dad never puts her on a couch or chair, because Majestic could roll off and hurt herself. He always keeps Majestic in his sight, so he knows if she needs him.
By 8 to 9 months, babies are able to sit on their own without support, feed themselves, and crawl. We'll watch a short video of a 9-month-old baby, Hayden, and notice some of these abilities.
It's a good thing Hayden's parents have already baby-proofed, because almost overnight, Hayden has learned to crawl. While there are a few exceptions, most babies crawl before they walk.
What is that? Who's that? Huh? Who is that? Huh?
Obstacles like this box give Hayden a chance to practice and perfect his new ability.
Where is he?
His dad is fostering Hayden's crawling skills, thinking skills, and self-esteem all at the same time. As a crawling baby, Hayden needs open and safe areas in which he can move and explore. A small collection of books and toys in the living room corner adds to his safe and fun learning environment.
Finally, by 1 year, babies are able to stand, walk, and more easily let go of objects they're grasping. We'll watch a short video of a 1-year-old baby, Amalia, and notice these abilities.
Amalia's leg muscles are stronger and her balance is better than a month ago. Now she is standing unsupported without falling down.
Good job! You're standing!
In fact, Amalia is starting to take her first steps. These are exciting moments, ones that she feels very proud of and quickly builds on.
Good walker! Look at you! Good job!
Now we'll transition to the development of the mind. Between 1 to 4 weeks, newborns can recognize their primary caregiver and, in fact, show preference for their mother's voice and smell. Between 3 to 6 months, they become aware of facial expressions, and between 6 to 9 months, they go through a process known as hatching, in which they show greater awareness of the environment beyond the mother and have a greater sense of separateness. By 8 months, they achieve object permanence. We'll watch a video to illustrate this. This baby has not achieved object permanence yet, which means out of sight, out of mind. This other baby has achieved object permanence, which means he knows the object is there even if he cannot see it.
Oh, now look. Under here. Oh, okay.
Between 6 to 10 months, babies begin to babble, and they have learned the favorite sounds of their caregiver's language. Between 8 to 9 months, they can respond to familiar words, and from 9 to 12 months, they begin to speak their first words. At around this age, there is an accelerated growth of neuronal synapses in the prefrontal cortex and dentate gyrus, which results in a much improved memory capacity. To end this section, we'll watch a short clip of baby's first words.
Say hi, Daddy.
Hi, Daddy. Hey, Daddy.
Good job!
Finally, we'll transition to talk about social development. Before the baby is born, mothers usually undergo what has been described as a primary maternal preoccupation during the final weeks of pregnancy. This is a period of increasingly inward focus with intensified fantasizing about the baby and a relative withdrawal from the concerns of the outer world. Newborns have little ability to self-soothe when feeling uncomfortable or in pain. Caregivers provide a scaffolding for the regulation of physical arousal and emotional arousal. By 2 months, we start to see the social smile. We'll watch a clip exemplifying this.
Haji.
Between 3 to 6 months, there is a marked interest in face-to-face interactions. Between 9 to 12 months, babies are capable of joint attention, when they shift their gaze between the mother's face and an object of mutual interest, signifying a new social-emotional reciprocity. This is significant because it implies a greater awareness of another's mind. Along these lines, during this time, babies display social referencing, when a baby seeks the mother's or other adults' emotional signals and uses them to calibrate their own reactions. Around this time, babies are also capable of deferred imitation, which means they can imitate someone from memory. Around this age, the greater awareness of others' minds increases a feeling of separateness from the mother and sets the stage for separation anxiety when they begin to protest the mother's departures and stranger anxiety when even familiar, accepted caregivers suddenly find themselves rejected. Older infants are increasingly motivated for mobility and exploration, but continue to use the mother as a source of emotional orientation. They crawl short distances and look back to receive reassurance, which is known as emotional refueling. We'll talk about attachment in another video, and to end this video, we'll see short clips to demonstrate the still face experiment, joint attention, and deferred imitation.
In the still face experiment, what the mother did was she sits down and she's playing with her baby who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing?
Canadá nós tivemos uma parada técnica hoje à noite. Perfeito, isso mesmo. Na seleção do Canadá. No momento para ter uma parada técnica.
So that's it for this video. You can take the test again on the link below, and next time we'll talk about toddlers.